So basically, I titled this. It was to make something about AKT. So I just basically titled this AKT in some minutes because obviously the AKT is quite big, and obviously there's nobody can talk about. You can't start and finish today. It's a season film. So I'm just going to tell you what I feel in a few minutes. And just like my name is Hamed, GPST3 due to finish, and just giving my one or twos about the AKT. So basically, we're just going to talk about a few things and about the exams, which would include, few facts about the exam, things we know already, statistics of the exam, not like the exam stats questions, but like the statistics generally, how people have been doing in the exams, and what the exam is about, and just a few other things. And then we talk about resources, and then I can take questions from people, more like questions that you've been thinking about, what and I've not covered in this. I can always take them and just help with them. And what I can help with, I can tell you where to best find answers for it. Um, I struggled with preparation for the AKTs, so I kind of know a lot of places to get answers from. So, but it's not like I passed, with flying colors. It was good enough for me to just pass. I'm sorry I'm not sharing my screen today, but it's just background issues. I'm sorry about that. I hope my voice is just fine enough.
Yes, that's fine.
So basically, we'll just talk about a few facts about the AKTs. We all know AKTs is computer based, and it's just MCQs. So it's just basically, you just click, 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 and click all the answers from beginning to the end. Um, what it does, it just tests your GP praxis generally. It doesn't test anything more than that. It just wants to make sure, you are good enough to see a patient, and possibly you are safe enough to do a few things. And basically what I tell people is, a lot of us have got, especially IMGs like us, we've got a lot of experience from maybe back in Nigeria. Like personally, I was in residency in somewhere, and a few people were consultants, a few people were this and that. It's not for you to think like a consultant, or think like you are in SDEC, or think like you're in the hospital. It's basically for you to think like you're in a GP practice. A few things that you would normally do in the hospital when you see a chest infection, you wouldn't do it in the GP practice, just because you don't have all these things in place. So the exam just tests, your GP sense. That's just it. And there are just four sittings every year. I think that would be January, April, July, and is it October? But basically, it's just four, and it's up to you to decide where you would where what when you want to write it. Um, Normally all the exams are the same, but there are a few tweaks this year. So I think the next exam will be the last of its kind, and from September it's changing. So uh, now it's up to you to decide if you want to write the already known exams, or you want to do the new formats. I will slightly talk about the new format slightly from what I've heard and what I know about it, but it doesn't sound like anything is changing. Mainly, it doesn't sound like there's a major change. It just sounds like it's still the same thing, but it's just in a different format, or in like different writings. But well, none of us has written the new exam yet, so we can't really say. But from what they've said, or from what RCGP people have talked about, it's not different. It's just lesser questions basically. And some one thing also is test centers. We know this. Sometimes it's best to get there as early as you can. I'm not even capping, because sometimes the staff, they don't know anybody. They just look at you and just talk shabbily. And sometimes some people will decide to follow the rules till and tell you you can't get in at this time and all that. Well, till now, I've never heard about anyone that, missed their exams, maybe because they went late or anything like that. I've not heard that yet. So I feel, the money is significant enough for all of us to think like, I can't miss it. I need to write the exams. And yes, you're allowed to have water when you go in, and in a clear bottle, transparent, obviously transparent water in a transparent bottle. Um, when you're in the exams. And at the same time, you're allowed to go on wee breaks, but it's part of your time. I'm not sure. I've never heard of. I don't know, except maybe you've got people have got overactive bladders and things like that. But most times people sit down in the exam from beginning to the end. If you are the kind that the more you drink, the more you wee. Maybe just stay off the water because you barely have enough minutes to actually answer the questions. Um, at the moment, at least till the next exams, you've got 200 questions, and what I mean by they test it all is whatever, anything you can think about, endo, MSK, chronic diseases, emergencies. There's really no format, I'm sorry to say, to the exams. It's just everything just comes and just depends on when you are writing, you just see everything and they test every single thing. They just ask questions from everywhere. So it's just like, you're doing everything again. And you've got 190 minutes for 200 questions. So it's best to just get in and get stuck in from the start. What normally happens with a lot of people is, maybe you've not really calculated your time right at the start, and maybe you start with a very slow pace, and then you notice when you've got 1 hour left, you've got 100 questions still to go. That's going to be very tricky. And one of the reasons why most IMGs fail, at least according to a research that was done, was that most people don't finish. And that is another place where you have to think about, special considerations. All of us in Nigeria, we never thought about any form of neuro issues or anything like that. I'm sure a few people are on the spectrum without knowing, and sometimes you need extra minutes than the normal people to finish your exams. If you notice that maybe you've written the exam once or twice, and you've not or you've struggled with timing, or you're practicing and you're struggling with timing, it would be nice to actually do the I can't remember what they really call the stuff. There's something about where you test yourself and you have a diagnosis, and then you can get extra time for your exams and all that. So obviously, even the RCGP will let you know about it. If someone fails an exam, the first thing they send them is, do you want to, look at yourself? Do you want to see if you can do this in this minutes and all that? And they test a lot of things, and you can get some extra time to finish your exams. But generally, um, the truth is the time is very enough. A lot of people come back after the exams and say, they had 10 minutes to just, go through a few things again. They had a lot of time. Some people will just say, well, just write enough. And there's no negative marking. So we know that already. Some of us will still have the PTSD from med school with negative markings and all that. But just click everything, please. Just even when you've got no time left, even if you just got 5 minutes, you just got 1 minute left, and you have like 1 million questions, just keep clicking and just next, click next, click next. So there's no negative marking. As at now, price is still £470. That's a 1 million naira. You can still buy land in my area for 1 million naira. I'm very sure in my village. So practically is the price of one whole plot of land. So I don't know. It's a lot of money, and I don't think you want to just give RCGP the money as much as possible. So 470 quid, at least for me though. I know there are some rich people and there are people that sell cars and sell airplanes and all that, but for me, 470 is a lot of money, and I think it's something that you need to actually prepare right for. So that's just the basic, like the few facts, or all the facts about the AKT. This is directly from what's it called? If most of this is just directly from the site, from the RCGP site, and from October, a lot of things are changing. Right now, like I said, you've got 200 questions that are going to be for 190 minutes, which is just about a question in 50 seconds. It's going to become 160 questions for 160 minutes. So that's approximately one question per minute from October. So if you think, you want to wait till October so you do less questions, you got more time, that's fine. It just depends on your choice and how ready you are. And yeah, definitely the prices are going up from 470 to 484 to 481. Well, the sections, even in from October, is said that it won't be changing. You'll still be having 80, 10, 10. Right now you get, 160 questions for, normal clinical knowledge, and you get 20 in each of the other ones. Um, and also, basically, like I said earlier, the questions just they address UK general practice, and they just focus on problem solving rather than facts and figures. Just more like most of the questions are more of scenarios. So they just say something and expect you to click or to just answer something as much as possible. So it's not at the same time where you definitely have to read wide and read a lot, or be familiar with things to understand it. The margin of error in a few or in a lot of the questions can be really, 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 really small. It could just be as easy as saying 10 tidal, breaths and 10 normal breaths. And then you're wondering, is it tidal? Is it normal? Is it 10 puffs? Is it one puff? Things like that. But if you've been doing a few questions, you would understand what I mean, by that. Exam statistics. So I've just basically gone through the last three exams, obviously apart from the one in April, because results are not out yet, and I don't have a lot of stats about that. Generally, pass rates for the exams have been between just around 68% averagely. So that's between 63 and 71% for each of the exams. And according to official pass rates, UK graduates, like UK medical graduates, comprise of 80% of those of like the pass rate for a first time UK medical graduate is 80%. Excuse me, sorry. So basically, if you see that the general pass rate is about 71, and first time UK graduates are like 80 something percent, it means that most of the fail rate is we like the IMGs, right? The ones that fail the more will fail more. Obviously, because it's a new thing, it's different. They're not asking about malaria and tuberculosis and things that we're very used to. They're, things that these are things that you have to pick up one after the other. And these guys have been doing these things from med school, different things. So I can understand that, but at the same time, it just means that we need to try. We need to prepare more than they have to prepare. So that's just what it means. And generally, average score for the AKT overall would be around 72, 73% will be the average score. The pass marks are always lower than the average, obviously, because I guess we understand how they do it, is the curve thing and taking standard deviations to decide the pass mark. So pass marks are exam dependent, just like we do with PLAB 2s and PLAB 1s and things like that. So I'm sure we understand all these parts. But what I've brought this out is this. I used to be of the notion where, I felt so these scores are just like, not clinical knowledge score, evidence score, and organizational management scores. If you were like me, personally, when I was in med school, I used to be a calculator. Most of my scores were around 52, 51, 54, that kind of thing, which was what I would do was, if I get 3 here, I get 4 here, I get 5 here. If I add everything together, it will become 50 now, so I'm fine. So if you're like me and you're calculating, okay, maybe I don't need to read a lot of statistics, or I can ignore organizational management, or maybe I should concentrate more on the clinical knowledge. I'm sorry to say, you need to pass everything to be able to pass the exams, except you are going to be extraordinarily passing clinical knowledge. You can't do without the rest of the parts. There's no way, because definitely it's going to be an average score. And average in the exams, you would have 14 ish in evidence score, evidence based, and organizational management. People get like up to 14, 15 because it's straightforward and it's easy to pass. It's like it's either this or that. So if you don't pass those domains, I'm sorry, there is a very high chance you're going to fail the exams. And is this calculation too that that deals with some people. So you need to, as much as you are concentrating on reading guidelines on asthma, hypertension, and all these things, you need to also make sure you are holding tight on the statistics at the same time, holding tight on the organizational management. And the truth is, if you ask me, it's easier to get high scores in these minor ones, which is, you know, the other ones, because if you give it, say, 2 or 3 days of, you know, consistent reading, you should be able to finish it. You should be able to, you know, read enough that you'll be able to pass any of these two. And although there are no, how do I say, there are no materials or, you know, syllables, so there's no way you can find out, okay, if I want to read everything on organizational management, this is why I find it. But there's nothing official. The what's it called? People that do tutorials and all that, they have notes where they put everything together, maybe like 3 pages as a whole for organizational management. And then if you just read it, say a day or two to the exams, you are fine. You just go and kill it. But I think basically it's best to concentrate a lot on those ones. And these clinical analysis are things that you would know. They are things you do every day, you know, and it's easy to just, and it's easy to fail those other two sections. So don't be like me. Concentrate on your organizational management and statistics. Is really important. It's going to be very difficult to pass the exams without passing them well. So we've talked about this before. So it's just the vision of how the exam is supposed to look like. Nothing new. I just want to talk about them, you know, one after the other. The clinical knowledge is basically mapped to the RCGP curriculum. The official RCG curriculum is online. It's there in the RCGP website. It's just everything we do normally. There's nothing new about it. Mainly in the exam, which is what I experienced and what most people experience, prescribing takes a very, very, very solid part about it. So, well, we call it like pharmacology back home and things like that. You know, most of the questions are going to, or like 1/3 of those questions are going to be about what antibiotics are you going to prescribe for this? Which most times for the common things, it would also test the days, number of days you prescribe it for. Maybe is it for 5 days? Is it for 14 days? Is it for 7 days? So common things, you know, chest infection. Do you prescribe for, you know, otitis media? Do you do this for this and this, like that? So prescribing takes a very large chunk of the questions, and the prescribing can be from any of the systems, basically. At the same time, too, it can be chronic disease management. You know, patient is already on this medication. What do you want to add to it? You know, it can be from like diabetes. Like sometimes I had a scenario once where, you know, patient was already on normal tablets, had significant cardiac risk factors. HbA1c came back elevated. What do you add to it? You know, and they pop all the GLP-1, everything in the options. Just select one. It can be as straightforward as that, or it can be tricky and saying, you know, how many they can put all the prescriptions there or normal prescriptions, and they've popped it somewhere inside that the person has penicillin allergy, and obviously we know the right thing to prescribe is maybe Fluclox, but you know this person has penicillin allergy already, so you need to note that in the question before you answer it. So a big chunk of it is prescribing. And I know where some people have problems too would be drug monitoring. Obviously, at the start, I had problems with that. But if you already work in a GP practice, a whole lot of times you would have been exposed to monitoring of these drugs. And most of the medications that you would have questions on monitoring are common ones that everybody know about. And they're just there. And like I mentioned before in the management, just think like a GP. You're not thinking like a cardio consultant, obviously. If it's as simple as needing a full blood count first, just select it. If it's as simple as saying, you know, a patient came in with leg swelling, chest, shortness of breath on exertion, what do you want to do? and they put options there and you see echo. Obviously, echo is the last thing you want to see to confirm the heart failure or whatever is going on. But if it's as simple as, you want to rule out anemia first, or you want to do a BNP, obviously they won't put two things that will be too conflicting in there. But the easiest thing will just be right there, what you would do in your GP practice, not what you would do as SHO or registrar in medicine, or medreg or something like that. What this means is just some questions, they just require you to know what the normal is, and that no further investigation is needed. They just put the scenario there and they put that, CT scan and this and that, nothing indicated. So that's just what some questions want. Just say, well, I won't be doing anything. Those are the kind of patients where you see in the practice and you say, let's see how it goes. If it's bad, if it doesn't get better in a week, let me know. In your head, this patient is not coming back. I'm just safety netting you just so that we know that we're safety netting you or something like that. It's not really something to be worried about. So those kind of things where you identify normal, you need to know what it is, and you shouldn't be tempted to say, just go and do investigations for that. Well, this is more like stats, evidence-based practice. Everybody worries about this. And I know a lot of people believe, hey, I'm not very good in mathematics. I don't think I'll pass this thing, this and that. I swear it's not mathematics. The maths inside, the amount, yes, in the exam you will do calculation. Yes, I definitely there'll be something to calculate, but it's not thick maths. You don't need to be Albert Einstein. You don't need any mathematics major knowledge to solve it. It's just normal, add and subtract, divide and add. Things that you do on normal basis. Okay. You are giving 3 tablets in a day. You want to give 7 for 7 days. How many do you need? 21 tablets. This is this. Okay, you calculate, you do drug calculations also. But the whole mathematics in there, it's not like thick maths. And evidence-based practice is not actually mathematics, definitely. And yeah, like I said, you need to pass it. You need to really pass it well. So out of the 10% of the marks that it makes, you should be getting at least 6, which is needed. That's the truth. So it's something you need to understand. And most of the questions on the evidence-based practice are more about interpretation of data. Um, more like, how do I explain that now? When they give you like graphs, or they give you like figures, diagrams, and say, which is the highest, which is the lowest. I know I'm making it sound so simple, but it's not as simple as, which is the highest and lowest, or although a few of them can be as simple as, boys are eating more than girls. Yes, and that's it. But it's just basically interpretation of data. I know a lot of us are using past medicine. Personally, I would say yes, it's good to practice with past medicine. It gets, especially for this evidence-based practice, it gets you ready for the worst possible event. I know if you go to RCGP test, self-test, and you do evidence-based, you will feel like you are the king of the world. And then you go to past medicine, you feel like you don't know anything. Yes, I agree with you. The real exam is basically in between both of them. It's slightly more difficult than what you see in RC. It's slightly not as straightforward as what you see in the self-test, but it's definitely easier than what you see in past medicine. But for the past medicine, it would help you to get ready for things like, this, knowing how to calculate mean, mode, range, and basically, percentage changes, comparing two data, comparing one or two things to the other. Also, it would be nice to learn how to do basic things like, sensitivity, specificity, number needed to treat, positive predictive value, negative predictive value. That's quite easy, when you do all the, how the table is. Most times the table comes with the exams as easy as that. You don't have to be, like in some questions in past medicine, you have to be writing the table yourself and be doing the A, this is B, this is C, this is D. Most times in the exam, they just give the table straightforward. because they know you have less than 1 minute for this thing. So you can just know the calculation, A over A plus D, B over A plus B, all those, the way you should know it. Personally, me, I don't know. I didn't know it through A over A plus B. I just knew, I used arrows. I knew sensitivity was going this way, specificity was going backwards, NNT was going upwards, all those kind of things. That's all me I used to know mine. And you should definitely know the difference between absolute and relative, because that will determine when you are calculating like numbers needed to treat. So you don't make a mistake when you're calculating it. Because the truth is, this kind of questions, if you don't know it, sorry, it's over. You don't know it. And maybe you would find 2 or 3 questions in the exams that will come that way. Obviously, if you know it, those are very easy scores. Those are very easy things to just, go with. And no matter what, don't go without knowing how to do mean, mode, range, and things like this, because they are so easy. And more than 90% of people that are getting the exams with, they will get the answer. So it's best you are just part of those people that are getting it. They're not part of people that are missing it. So something like this is basic. You should know that. And it just depends on how what the exams comes at. Sometimes you get very easy graphs, and easy questions, and saying, what is this? Okay, it's a forest plot. What is this? Is it this? Okay, which is relative to this? All those kind of things. But sometimes can be quite annoying. Personally, what I would say is, if you see annoying graphs, just flag it. Because basically the way the questions come is similar to the way the setup is similar to the way your RCGP self-test if you do it on your computer. So you see all the numbers there. You can just flag the question and maybe click an answer, so that in case you don't have time, just click an answer, flag the question, and come back and see if you can calm down, look at the look at the the chart again, or the figure again, because sometimes it can be quite difficult to, a few of them, maybe 1 or 2, can be quite tricky. So if you think it's wasting your time, just click an answer, flag it, and come back to it. It's easy. And the RCGP themselves, if you go to RCGP website, under the courses available, they do AKT courses. They do refresher courses, introductory courses like we're talking about now. They go into more details sometimes. They do, part 1 and 2 of it, which I attended. It was free. And they do some that, you will pay for. So if you want some RCGP, something from the source, you can always go to RCGP's website, and you can take a course on evidence-based practice. You can take a course on what's it called? On the other part, which is the management. A whole lot of times, people that don't pass, maybe at first attempt, the deanery does organize like online teaching for them, maybe for like a week or 2 weeks. And most times it focuses more on this evidence-based and the management, because most times they know most people don't have problems with clinicals. That's the truth. This is just about organization. You are dealing more with ethics, main things, ethics. Most of the things that will come there is ethics. And the ethics can be quite annoying, because the questions can be quite lengthy. They're like writing 6 lines, 7 lines just because of one question. And sometimes, I don't know, people like me, I get bored a lot. So I should say I have like borderline ADHD. When I start reading the question and I see the first line and I'm not even understanding, I'm already annoyed, I'm pissed off. So in those kind of questions, you need to calm down. It could be saying, I think the easiest thing that you will see would be someone that you're not sure they've got capacity. Most of the questions will be on ethics, and they'll be mainly on autonomy, capacity, and simple things like that. It could just be saying and trying to be sure someone is safe. That's just basically it. Very quick example is, say, someone with dementia staying at home, felt, you feel they need some treatment, and they're saying they don't want it, and they'll write it there boldly and clear that they know what they're saying, they don't still want it, they've got capacity, and they don't want it. What would you do? Do you want to call the judiciary? Do you want to call police? Do you want to send them inside? Obviously, depends on how urgent the treatment is. If it's something that you can do again, even if they don't have capacity at that time, the best will be to reassess again or come back in a few days and come and assess them again and saying, okay, now today, what's happening? Do you want it now or not? Which is simply what you would have done in practice. But sometimes you see the answers and you feel like maybe the easiest thing would just be to send them to A and E, which on the long run will be the wrong question, will be the wrong answers. And a tricky part will be with DVLA rules. There's a lot of rules with DVLA, people that can drive, people that you should hold their license of, people that this and that. Most times there is a DVLA guide, really, but it's very lengthy and very wordy. Normally, these kind of things in the practice, obviously it takes doing and doing and doing. Okay, someone with dementia, you should think about their driving. Someone with OSA, depends if there is a HD3 drivers and all those kind of things. And also, as you do practice, you would have been seeing a few patients, or like at work, you'll have been doing some medical examinations, and for DVLA. They also make you, understand what these things are about. But basically, for the exams, I think it's best to just find a place where everything is concise and you can just understand what you need to know and forget about it. Because later on the long run, you might just have to be referencing the DVLA notes because there is actually a DVLA guide on driving and everything like that. Then you need to know immunization and notifiable diseases. It might just be one question, but sometimes it might be more than that. Obviously, there's a lot of things, that too many things under it, and it's just 20 questions. And going forward, it will be like 16 or 18 questions. So obviously, a few of these things might just be one or two. Then another one is fitness to fly. It can also be quite tricky, conditions of fitness to fly. There's also everything here has books about them. If you check the aviation, there's an aviation UK aviation, something about fitness to fly. It's got everything systemically, neuro, respiratory, cardio, this and that. I think what you just need to do also is just a handout summary. Like I said, a lot of people have handout summaries on this. I had one that I used. I don't think I'm allowed to share it. That's why I did not bring it. But definitely, what I would recommend is get a handout summary of everything you need to know for the exams, which would include, benefits, control drug, consultation models, fitness to fly. What I forgot to add here is, and it's very important, is what's it called? Death certification. Very important. There is no way one or two will come about death certification. So it's very, very important. Sorry, I forgot to add it here, but it's very important. So there is like I had this handout summary of like 3 pages or 4 pages that had everything in one thing, and I had like a voice note where it was like 3 different lectures that I recorded, and I just played it in my head, and I played it on my way to the exam, and I just went to go and write it. That was what I did. But definitely you can't you can't go online and be checking everything one by one. It's a lot. It's really a lot. So I think it's best to kind of get a handout summary, and we'll talk about all this more. So approach to exam. Well, there's nothing, there's no, how do I say it? There are multiple ways to the market. There are multiple ways to get there. The real thing is to just pass. But at the same time, you need to write the exam when it's right for you. The right time is different for a lot of people, but when it's right for you is best. Personally, if I was to recommend, I would say write your exams late in ST2 or very early in ST1. In ST3. I feel writing in the first half of ST2 will be too early. That's what I feel, but it's different for everybody. I don't know how long you've been preparing. I don't know what you know already. I don't know how long you've been in the UK Obviously, we've been in the UK system for quite a long time. That's totally understandable. But there's a new trend of people coming directly for what's it called? Coming directly for training from home. And I feel 1.5 years in the UK would not be enough. How do I say it? Would not be enough for you to have the baseline knowledge you need to go and pass the exams. Because apart from your preparation, you still need some baseline. You need to just know a few things baseline because you can't read everything for the exam. I'm 100% sure. And even if you read everything, you can't remember everything because at this stage, it's not more, your concentration is not just on books alone. We've got a lot of things to think about. I don't know. In my own case, I've got kids. I'm thinking about money. I'm thinking about visa. I'm thinking about getting a job. I'm thinking about house. There's too many things to think about. So I think you need to find the right time for you to write it. And I think the best time, or generally what I would advise anyone is late ST2, best for me, very early ST3. That's what I think is best. That's my own point of view. But at the same time, I think it's best to write the exam when you are in a GP practice. Now, why I think so is this. One, in the GP practice, you're already seeing patients regularly, which, after each patient is a form of revision for you. You see a patient that's coming with, chest infection. It's a very quick revision. Where we think you might be, you see a patient that's coming with hypertension. You just changed somebody's amlodipine or felodipine because they had leg swelling, and you popped them on AC inhibitors, or you added indapamide. What did you check first? What did you put in place? These are very quick ways to revise something, and the best place to revise anything quickly is what's it called? Is nice CKS. And say you've seen a patient with simple elevated blood pressure, you've just changed their medications, this and that. It wouldn't really hurt to just, say, if you just write it down. If you can't do it on your break time, you can do it when you get home, or just get an hour of writing, hypertension CKS. And you just see everything there. You see how you can swap the medications, this and that. Obviously, you might see multiple things in a day. Some days you have recurring themes where you're just seeing back pain and leg pain and just saying go to physio, go to physio, go to physio. There are days where you'll be seeing myriads of things. Obviously, you might not be able to complete the whole thing that day, but definitely I think if you want to prepare for the AKT, you need to have notes. You need to have a note. If it's not a written note, if you're like me where you don't like anything paper or biro, digital notes, just write it there. Something you want to look at: hypertension, diabetes, gout, anything like that you want to just quickly look at from nice CKS, just write it there. And it's so easy to find these days. Just simple Google what's it called? Um Depression CKS. It brings it out. And it tells you all your options. It tells you medications. It tells you, and they are very quick summaries. It's not like the long things. At the same time, it's an exam where you need commitment to practice. I'm sorry, I don't think it's something you can crash. I can't tell you this is the amount of time, or you need 2 days to prepare for the AKT, or you need 5 days. We're all different from each other. Everybody knows how they do things. But generally, I would say you would need at least 1 month to prepare if you are the smartest person I know. At least. If you've never prepared before, if you've never seen this, if you've not been exposed to it before, if it's your first time starting to prepare for AKT and you want to give your all into it, and you are like, top in the class, normally you are the smartest person available, I think you would need at least a month. But everybody is different. Some people, 3 months, 4 months, but you need a schedule, really. And you need to understand that, you can't pay too much attention on just clinicals and you abandon this or that. That's why you need schedules. And definitely you need question banks. Coming to question banks, there are a lot available. I don't think you need to do too much. Personally, from my recommendation, I would always say a mix of RCGP self-tests and past medicine is good enough for the exams, for question banks. I don't think you need more than that. Generally, the exam looks more like the RCGP self-test. The the way the exams are worded, the way the questions are presented, the way the options are, the way the format of the exam looks more like the RCGP self-test. But generally, I think it's slightly more difficult than doing an RCGP self-test mock. Probably the reason would be that maybe because RCGP self-test, you would have seen a lot of the questions before, and you are slightly familiar to the questions when you are doing the mocks. Maybe if they did a way where RCGP gave you new questions every time for your mocks, maybe it would be more like the exams. But I think personally, I think that's the reason why the exam is slightly more difficult than the RCGP self-test. But definitely it's easier than what you see in past medicine. I would always say that. Past medicine is it's quite complicated. And I'm not saying you shouldn't use it. I think you need it at the same time to understand that, it can be this bad, and it's not this rosy as what you see in the self-test. But I think when it's closer to your exams, what you really need to know is format. So at the beginning of practicing, at the beginning of getting ready, I think, you can start with past medicine. And towards when the exam is coming, maybe towards that time, I think you will need more of RCB self-test because the exam looks more like the RCB self-test. There is a room for tutorials. Um, Definitely there's a lot of people that do I don't know what's it called, like sessions, like we mentioned earlier, people that teach people about AKTs, paid tutorials and all that. I don't have a paid tutorial. I'm not I don't I know people that do, but I'm not going to advertise for anybody. But I know, and I would always vouch for them and say, personally, I think if you've struggled or you've noticed that you started and you've been struggling, I think the least you should do would be to get notes from a tutorial, from a known tutorial. That would be the least you should do. Obviously, if you think you need to attend, like physically, and pay for the whole package, that's good. But I think the least you should do, if maybe you're here and you've written the exams once and you struggled, or you think you're struggling with preparing for the exam, is to get notes from a verified tutorial. At least that, puts you in the path of what you should start to read. I don't think there is any strategy to the exam. I think you should just go there, read, get ready, and go and click the questions and click the answers. And what I mean by sticky questions is just there are a lot of how do I say it? Interesting questions in the exams where there are a lot of them. I'm sure like 20% of the questions that you would have where two answers really, really look like the right answer. And you just need to know the guidelines for you to say this is the answer. That's the truth. Those are the kind of presentations where you come to the practice and you can say, let's treat this and see what happens about that, or do a double barrel treatment and say just cover for both of them and you're fine. But obviously this is exam, it's not real life situations. You need to actually know what the guidelines say to pass to get to answer those questions right. So there are some questions where they can be very tricky and the answers they look very much alike. We already talked about resources. We spoke about a few resources before we started. There is this Aurora revision schedule. I was hoping to get one to bring mine out, but I couldn't find it. So it's just like a calendar, simple. You just know, it's like you know yourself, you know where you struggle the most. Personally, for me, I struggle a lot with internal medicine issues. I have never liked medicine not like medicine as a job, but medicine as, I'm sure you understand what I'm saying. Anything that is not surgical or any other thing related, once it's medicine, I don't like it. So, and I knew my weakness was more of like neurology and things like that. So I had a schedule where I had to spend more time on medical topics and neurology and refresh my cardiology and every other thing. So the right revision schedule kind of has like it's like a calendar, and you just fix things you need to do. So it's like knowing, okay, I've done this, I've done that, and obviously it might not work for a lot of people. Some people are just on the go. Let's just see what happens. But that's what the revision schedule is. It's available online. You don't need to pay for anything. You just have it. And you can also do your own calendar and you just put things there. But it's just easier because that one has like topics and all that. Um, Obviously, there are resources like, these are the question banks, e-medical question banks, past medicine, GP self-test. You don't have to use the three. Personally, I say any two. And any two would be GP self-test plus one other. I've heard that there's Samson. I've never seen it. I don't know how good it is. I don't know anything about it. But I heard there is Samson's. But I've never seen it. Your best shot to any guidelines is obviously nice CKS. And like I said earlier, it's easy. And there is like a guidelines of co.uk. I know a lot of us know that already. And you see guidelines to simple things, and you can attend courses. The FSRH, helps with a lot of things with, so gyne is, I think that's gyne and things like that. And all these are just, where you can see where you can see easy guidelines on what to follow. Then we've got past examiner reports. Um, Available on the RCTV website, I'll show you after this, is exam reports from 5 years. And it basically says what people struggle the most with. And personally, I would say if you want area concentration for the exam, that's where it is. So it lists the topics and everything like that. And you can just go through it. Over the past 3-4 exams, these are the common themes, that people have struggled with from the examiner reports. The main one is death certification and referral to coroner. There are some deaths that you do not need to refer to the coroner. There are some that you need to. There's also a tweak about the weekend, if you need to report to the police or not. So that is part of the whole organization and management things about death certificates and all that. And there are a few things you cannot write in death certificate. There's a way, there's a 1A, 1B, 2, and all that. I believe, if you read more about death certificate, you understand that. Neonatal illnesses is one thing. Blood pressure management, not just blood pressure, really. I think you should have at the back of your hand, basically management of the common chronic conditions, blood pressure, diabetes, blood sugar, asthma, COPD. What else? Well, I can't remember, but basically those four. There is no how you would not see at least maybe like 6 or 7 questions coming from around there. It could be medication tweaking, it could be adding medication, it could be simple questions like targets for HbA1c. It could be, just looking at what's it called? The breathing spirometry and saying what it looks like. But it will be simple things. But if you don't know them, you don't know them. I know one area that a lot of people struggle with is dermatology. But the truth is, most of the dermatology that comes in the exams are straightforward dermatology things that you would normally know, like SKs, treatment of SKs, AK, fungal conditions, and very simple things, not like the chronic things. And then definitely you can't, in dermatology, there will be them cancers and SCCs and BCCs and melanomas. But people have been struggling with dermatology, obviously. And palliative care treatments would definitely be in the exams, and people have been struggling with it. And generally, neurological symptoms. So I felt I should write a few, how do I say? I had what's it called? Like I said, I had a note. I had notes, and most of the things I wrote in my notes were this. Um, so if I was to write like, okay, if you are going for the AKT and you don't know anything, what should you know? This is it. Most times, if you know this, at least you will not come up to the exam feeling like you've done nothing. Like I said, this is a very good resource if you want to think about AOC for AKTs. So it's just, I know a lot of people don't know these things are available on the internet. So I'm not sharing anything that is not available anywhere. It's just straight from the internet. So it's just summary of, AKT feedback in the past 5 years up to January 2025. And this is just, telling you, also just to just digress. Some of the graphs or the images you would see, or what is it called, can also look like this, and they can ask you uh what's the most things that what's the most common one or something like that. Obviously it would be the highest on the graph. It can be that simple, or they can tell you what's the least, the lowest on the graph. It's just about interpreting. So it doesn't have to be like tick statistics and finding mean deviation or standard deviation or something like that. So this just talks about topics where people have struggled. Care of transgender, obviously at the top. um Evidence-based of antibiotic use, risk communication, data interpretation, so antidepressants and interactions, and things like that. So basic, just everything there. So it's just available online. All you have to just do is type in AKT feedback for the past 5 years, and you see everything. So what I was talking about, consent and capacity, pregnancy complications. So if you want like AOC, or like, what do I have to know, at least baseline, I think the best way is just to get this and then just look through it and see that, you tick all these things off first, then you are fine. It's just a few topics. It's not really a lot of things, and but it's what people have actually struggled with in the past 5 years. And obviously, if they've said so, it means that these things actually came out in the exams. So it's like these are the exam questions, something like that. Yeah. Thank you very much, everybody.